Yes, we can give you the region. The influenza death was a child from the Northeast region, and the COVID-19 death was a child from our Western region.
Thank you, Tom. Next question to Ashton, WKBT in La Crosse. Ashton.
Hi, can you hear me okay?
Yes, we can hear you. Thank you.
Awesome. Just wondering, is there anything that you can tell us about changes to vaccinations in the state in the wake of this?
Well, again, these pediatric deaths just happened in the past couple of weeks. As far as the result on immunizations and vaccinations, there's nothing that I can really share at this point. But we really do want people to consider that these types of tragedies can't happen. And the best way to prevent these things is obviously to get vaccinated as quickly as possible. With the holidays coming up and the get-togethers with the relatives, friends, we really encourage people to get the vaccine for both COVID and also for influenza. It's not too late, and it's a safe vaccine, and it's still in plentiful supply.
Thank you for that. We go now to Eric Gunn, Wisconsin Examiner. Eric.
Thank you very much for doing this. I infer that you will not give us the exact ages of the children involved, although if you can do that, please do so. But in the absence of that, can you tell us at least whether they were infant or 2 to 5 or elementary age or middle school age or high school age?
Yeah, at this point, what we tell people, what we were telling the reporters, again, for privacy issues, is that the pediatric population, less than 18 years old. And again, to protect the patient's privacy and the respect of the family members, that's the information that we could share at this particular time.
Thank you for that, Tom. We go now to Sean Kirkby. Sean at Wisconsin Health News.
Thanks. Can you share the vaccination status for the patients who died? Thank you.
The vaccination status is, again, something we don't usually look into, but we are trying to verify whether these children were vaccinated. If they were vaccinated, were they vaccinated within the 2 weeks prior or prior, excuse me, if they were vaccinated within 2 weeks of their deaths. At this point, the investigation is still going on in both of the cases, but that right now, Sean, that's all we can really share at this particular point, but it continues, the investigation continues.
Thank you for that, Tom. Let's go now to Mike at the Associated Press. Mike, are you on the call?
I am. Thanks for taking it. If I could, well, first, just to clarify your response to an earlier question, are you answering how flu and COVID vaccination rates of children are doing this fall compared to last fall? I think that was the earlier question I wanted to clarify. And also, I was wondering if you could comment on current proposed changes by the CDC to the childhood vaccination schedule, if you had thoughts on that. Thank you.
Yeah, the first one, basically, our vaccination status for children for both COVID-19 and influenza are very low. We want them to be increased significantly. And to be honest with you, it's kind of disappointing, the numbers that have come in. I can say that so far in Wisconsin, overall, for all ages, 28% of Wisconsinites have been vaccinated for flu, and only 10.6 people, residents from Wisconsin, have been vaccinated against COVID-19. These numbers really do need to increase. How that relates to what is going on at the CDC and their recommendations, we really don't know at this particular point. We're still studying this, trying to get all the information together and put out the most effective recommendations that we can, based on whether it's from the CDC or from some other agency like the American Academy of Pediatrics or several others. So our immunization program and our state epidemiologists are working on that to make sure that we get our recommendations out that are consistent and what's in the best interest of the Wisconsin residents.
Thank you, Tom. Let's go now to Shanna at WMTV in Madison. And I know we just connected her with the link, so I'm checking to see. Oh, I do see you on the call. WMTV.
Hi, thank you so much. Yeah, I actually don't have a question prepared, but thank you.
Okay, Thank you for that. Evan, CBS 58 in Milwaukee. Evan. All right. How about Jonathan, WHBY in Appleton? Jonathan at WHBY. Neil, WCLO. Neil Johnson, WCLO.
Yes, hello, thank you. Can you
Hi.
talk about RSV specifically? I don't know if this factors into this particular announcement, but what are health officials seeing statewide with RSV? And then a second question too is I think people here would like to know what is the youngest viable age to get either a COVID or a flu vaccine or both that the state recommends?
Okay, I'll answer your second question first, Neil. 6 months is the earliest that you could get a influenza vaccine or COVID-19 vaccine. We do continue to recommend that anyone over 6 months of age, get the vaccine. We are going to continue to put out our recommendations for all people to consider it, to either talk to their providers or at least go into their pharmacy and see if the vaccine is available and right for them. But 6 months is that age. RSV wise, that's one of the top three our respiratory viruses that we really monitor: COVID-19, flu, RSV. RSV is a little slow this year, but that's not anything out of the ordinary. RSV usually starts either before flu or comes after the flu as far as the activity increasing and the peak activity. We've seen a few hospitalizations from RSV. Many of them have been the older population, and I'm going to say the older population we consider to be 65 and over. Scattered number of very, very few cases of any children that have been hospitalized for RSV at this particular point. Right now, RSV is lagging, but we expect that it's going to be increasing over the next few weeks and months, as has COVID-19 and influenza.
Thank you, Tom. We have time, I think, to go around again. So why don't we go back to Maddie Heim at Milwaukee Journal Sentinel. Maddie?
Yeah, thank you. I think I might have misstated my first question a little bit, so I'll just try one more time. I guess in comparison to last respiratory illness season, I'm wondering how many how many child COVID deaths occurred maybe last respiratory illness season, if you know that number.
Actually, trying to compare it from year to year is very difficult no matter what. I know there had been several cases of pediatric COVID last year. I don't know what the timelines are, Maddie. I'm sorry.
And Maddie, do you have a follow-up?
Not at this time. Thank you, though. Appreciate it.
Okay, thank you. And Alice at WBAY.
Yes, thank you. I'm sorry if this was already asked. I had to step away for a second. I'm not sure if you're able to answer this, but do we know if either of the children were immune compromised?
Both children had some underlying conditions that would increase their risks of the influenza infection and COVID-19. Can't get into a lot more details about that, but both children did have some underlying risk conditions.
Thank you. And is it okay if I ask a quick follow-up?
Yes.
Sure.
Okay.
Tom.
I heard you say that about only 10% of the eligible population, that the number of people who are eligible to be vaccinated, only 10% of people eligible to be vaccinated are vaccinated for COVID. Did I hear that right?
Yes, 10.6% at this particular point. That's the latest statistics. Those statistics are usually updated on Friday afternoons, but for what we have right now, it was 10.6%. You're correct.
Okay, thank you.
Thank you. Why don't we go now to Ryan Lynch? Apologies, we missed you first time around. Ryan.
That's okay. Thank you so much. So I've talked to other doctors who have said that they've had interactions with patients where there seems to be more hesitancy when it comes to vaccinations. Is that something you've seen with some of the patients you've worked in the past few months or past year or whatnot?
Well, we don't work directly with the patients, but we work with the doctors, and that is a message that's been coming across. Part of it is some of the confusion that's come out of the recommendations from CDC and the Association for ACIP. I'm sorry, I'm drawing a blank as to what that stands for, but there has been some confusion on that. But we are going to continue to deal with the recommendations that we feel are best for Wisconsin residents, both for pediatrics, young adults, and the older population as well.
Thank you. And Ryan, do you have a follow-up?
Yes, and I think someone else might have asked that, but just again, clarification. In the press release, it said that respiratory diseases were on the rise. You may have answered this already, but is there a specific data point for how much they've increased by? Or I think you may have been indicating earlier that might be hard to compare it to this time last year.
Yeah, it is definitely hard to compare from year to year because some years influenza and respiratory season starts early. Sometimes it starts late. We've had instances where our activity hasn't even begun to start until like the first of the year. In other cases, it's been October when it starts. So it's hard to compare from year to year. But we are definitely seeing an increase in influenza and COVID-19 at this particular point. And that seems to be very consistent, not only in Wisconsin, but also the Midwest and in the United States as well.
Thank you for that. Let's go now to Ashton. Ashton at WKBT. All right, maybe Eric Gunn at Wisconsin Examiner.
Thank you for this. When were the last deaths recorded of people under the age of 18 from respiratory illnesses, including flu and COVID-19?
Prior to these two cases, very unfortunate cases, started. We count our surveillance at the beginning of October. That's the beginning of our season. Prior to that, it was last January, maybe early February, there where we had pediatric deaths from flu and from COVID-19.
2025, January 2025, February
Yeah,
2025?
2025, okay. Yes. In the previous respiratory season.
How many were there then?
For total, we had 5 of influenza. I don't have the number off the top of my head for COVID at this particular point, but I know we had 5 pediatric influenza deaths last season.
Thank you.
Thank you, Tom. Sean at Wisconsin Health News. Do you have another question?
Yes, thank you. Tom, what's your forecast for the respiratory disease season? You're expecting it to be better or worse than previous years?
Well, it's really hard to say, Sean, on that. I mean, we've had cases where it started off thinking in past seasons where we thought it was going to be one of the more severe seasons, and all of a sudden it turns around and it wasn't so bad to begin with. There's always a lot of speculation going around. There is that particularly mutant strain that's going around with H3 virus influenza that maybe does not give as much protection, which means a lot of people are thinking it's going to be a more severe season. Based on what we've seen in the Southern Hemisphere, Australia and New Zealand, they have had severe years, but also very prolonged years from the time it starts through the higher activity till the time it peaks. It was much longer this year than it has been in the past. So we don't always follow what happens in the Southern Hemisphere, but those are the things that we're looking at. And that's why we continue with very strict surveillance in multiple ways at the Department of Health Services. Virologic, influenza-like illness outpatient. We're looking at our wastewater, our wastewater surveillance systems, all of which it's hard to make a prognosis as to what it's going to be. We're hoping for the best. And the only way that we can really change that right now as public citizens is get vaccination. That is by far the best way to do it. Even if the match with the H3 is not as good as what we anticipated, it will offer protection in keeping people out of the hospitals. It will prevent them from seeking medical care, and it would more than likely increase the possibility or lessen the possibility of any fatalities amongst any age group.
Tom, thank you for that. Let's go now. Mike, Associated Press, do you have another question?
I do. Thank you. To follow up that earlier question about, you said that 28% of Wisconsinites are vaccinated against flu and I think 10.6 against COVID. I was wondering what those vaccination rates were at the same point last year. And I have a follow-up if I may.
Yeah, judging from last year at this point, it is lower. The exact how much lower, I don't really have that information, but these numbers are lower than what we've seen over the past few years, and that's very unfortunate. Again, we really want people to realize how severe influenza is, both not only in the acute stage, but also at follow-up. So what can happen after you have the acute stage of influenza? Influenza could lead to further cardiac problems for both children and adults. It can lead to encephalitis. We've had cases last year of influenza-associated encephalitis, which we had a very special surveillance for. So it's not only the acute part of influenza. It's what can happen later on, protecting yourself and protecting those people who are around you. But those numbers, Michael, are lower than we've had last year by a good amount. And again, I don't have the exact number, but we're something that we're hoping that the trend will continue, will increase their number of vaccinations of Wisconsin residents.
Okay, thank you. And my follow-up was the two deaths that you're reporting, the two children. When did they die? Which week or what month?
Within the last month is what we can say at this particular point. And once we are notified, we need to verify it. We get specimens in to verify what if it is indeed correct. Laboratory errors have happened, but I would say the vast majority of the time when it is validated by state lab, we come up with the state results. But that's part of our protocol, is to verify these particular deaths, make sure that we don't have to retract at a later point.
Thank you, Tom, for that explanation. Let's go now to Savannah Tomei Olson. Savannah, you have a question?
Hi, Tom. Thanks for doing this. We've seen such an increase in vaccine hesitancy for a variety of reasons over the last few years. And now we have these two Wisconsin families who have lost their kids. So what would you tell parents across the state who are hesitant, maybe are getting their information from social media, or who haven't gotten their children immunized so far this season? What do you want them to know?
Well, basically, we want them to know what the most accurate source is, for getting vaccine information. And that would be through their Department of Health Services, through local health departments, through their own physicians, clinicians as well. Social media can, as you know, Savannah, is something that can be all over the board. People misinterpret things, but again, local health departments, state health departments, their own physicians, they're the ones to know, and they should be advising that these particular children get vaccinated. As I just mentioned, nobody wants to lose a child, let alone have a child die during the holiday season. We got to feel so sorry for the families that are going around, and we certainly offer our sympathy to all the families and friends of these two children that died. But unfortunately, these things do happen. The best way to prevent it is to get the vaccination. We believe it's safe. Again, it's in abundant amounts, and it's something that will offer protection, hopefully a lot of protection, but at least some, especially if we're dealing with that H3 strain, that will keep them from being hospitalized, keep the family members alive, and keep them from seeking medical attention. Know the best, in a nutshell, know what the best and most accurate information is and where it's coming from. And that would be state and local public health and your physicians.
Thank you. And Savannah, do you have a follow-up?
That's perfect. Thank you.
Thank you. And we go now to Shayna at WMTV. You have a follow-up?
Hi, thank you for the second chance. I know you mentioned the investigation is ongoing. I'm curious at the state level, kind of what next steps, what pieces of information is DHS still waiting for in terms of, is it lab confirmation or tracing?
Yeah, it's basically right now we're looking for lab confirmation and also verifying vaccine status. There has been times where the vaccine status has been in error in the past. So we go through with our Wisconsin Immunization Registry. We verify that with medical records to make sure that we know what's going on. Also, as you mentioned, it's laboratory as well. With these cases, especially if it's an H3 case, we want to verify that state lab that is an H3N2. If it's one of those that has a bit of a mutation to it, they will then test what's called sequencing, home genome sequencing, which unfortunately takes about 2 weeks or more to get done. And that would tell us how that responded, if that person is indeed vaccinated, how that person responded to it, and if it was a vaccine failure or a vaccine whatever the case may be. As you mentioned, it is laboratory, and it also is a matter of verifying some of the statistics that we already have. Because again, we don't want to have to backtrack on these things when we're dealing with any kind of pediatric test or any test for that matter.
Tom, thank you. Neil Johnson at WCLO, do you have a follow-up?
Yes, if you're at this point closely tracking influenza and COVID-19 cases on a kind of a county level, are there areas in Wisconsin right now that are considered hotspots based on serious illness or hospitalization? And if so, I'm wondering what regions of the state that would be, and if there's any correlation there with vaccination rates. If there are higher incidence of cases in places where there seem to be less vaccination, or what you're seeing there.
Okay. What I could tell you, Neil, is that obviously we have higher number of cases in the more urban areas like Milwaukee and Madison. We have seen increases in the Milwaukee County area over the past week or so, and that does correspond with our wastewater surveillance as well, which is seeing increases in the number of sites that are seeing influenza, specifically influenza type A. How it really corresponds with the vaccination status, we'd have to do a lot more checking on that. It's a long process to really break all that down at this particular point. But all we can go by right now is our vaccine status statewide, which again is very low. So we want to see increases everywhere throughout the state. But again, seeing more cases in more of the urbanized area, which is what we would expect. But there have been cases throughout the state in every county.
Tom, thank you for that. And with that, we are going to wrap up today's call. We want to thank Tom for joining us, and we want to thank all of you for participating. If you have a follow-up or you have a question we did not get to, please reach out to DHS Media, and have a great afternoon.
Thank you, everybody.